Okay, I'm Victor Kiatama. I'm the HR officer, which is the human resource officer for the Ministry of Health. Currently in Liberia, because of bad road network and even the limited banking system in our country, health workers found it very difficult moving from one facility to another in receiving their salary. So this is the reason why we thought it wise to maybe even introduce another options for them, because there are a lot of challenges. Some of them pay up to $5,000, before moving from one facility to another for them to receive their money, and they will abandon the health facility. When the supervisor go to the health facility, they abandon the health facility, all in the name of going to get my salary from the bank. There are a lot of impacts, negative impact, because for example, right now after the Ebola, we are trying to build that resilient health system. And in building a resilient health system, health workers need to be at the health facility. They need to respond to the patient concern. So right now, if health workers leave from the health facility, coming to Vanjama for a salary or going to Monrovia, and a patient or a pregnant woman go to the health facility, there's no professional health workers, the person will eventually die. And that is a serious case. We are trying to reduce maternal mortality in this country.
I am doing delivery, midwifery is what I did. I've been doing it for almost 4 years. Each time I want to get money from the bank, I have to leave the facility and go to the bank. When I leave the facility, most of the patients will suffer because I won't be around to cater to them. And just quite recently we received staff, but before we were not plenty, we were on a staff here. One person running shift. So what if you leave your shift to go for money, then your shift becomes empty because others are running the shift by themselves and they feel tired to run your shift and run their shift. So obviously you just have to leave it and run to go and come. If God make way for you that day you come back, fine, then the patient will not suffer that long. But when you go, the bank is very packed, you will not be able to get the money on that day. Then that means the patient will suffer for a long time.
Mobile money is an opportunity, and for us we embrace this program because it will help us to alleviate the challenges that health workers face in moving from one facility coming to the urban area to receive their salary. So for us at the Ministry of Health or as a government, we are very happy to embrace this process in order to reduce the challenges our health workers face.
Mobile money will be good for my employee because of the distance to cover to go for salary. Because from there to Vanjama, at times when they come, even the bank is closed, station is down, and he's spending about 2,000 from my district to Vanjama and 2,000 to go. So it's costing them a lot of money to come here for money. And besides that, if they don't reach Vanjama, they will go Bon County. And when they go Bon County, the system down, they will not get their money. That they have to find place to sleep, which is costly, and have to find feeding for themselves, which is costly. And even doing education, and a teacher from my district came here and spent 1 week to get a salary. They fell right before the bank and died because of the delay, and there was no feeding for that teacher. He died instantly.
I feel that the service is easy to deal with because of our road, where we used to take 2-3 days running behind one salary. But this time around, I will be right in my room, my money, then in my phone, and I just go back around me and go cash it up. So I feel that it is very, very easy. The biggest benefit in it is that I always be with my patient and then get my money. So that's the biggest benefit in it. They even said, let me see the first people go, but I immediately put myself into it because I feel it is very, very beneficial. I just encouraging friends so that they can also be like me. Let us involve into the mobile money business because it will cost us less expensive. And always we as clinicians will always be with our patients. So they must be like me. Instead for them to be with the bank where they will have to leave the patients, nobody to take care of them, and then they are on their feet looking for the money. The rainy season is coming, the road will be spoiled. Maybe the very day you decide to go and come back, you may not be able to reach the bank that day and come back. So the mobile money is much more better. That's all my advice.
I want to say a big thank you to the mSTAR team and the Lone Star for this fine idea, and also to the government of Liberia, and also to our health workers who are willing to join the mobile money. We say mobile money is an option, and that is try mobile money. I believe definitely it will work, and will help us for to meet our general goal, which is our indicators and to build a resilient health system in Liberia.